You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. Also, quick disclaimer. The opinions shared by our guests are their own and don't necessarily reflect the views of Otis MotherToBaby. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a MotherToBaby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the MotherToBaby Podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a Teratogen Information Specialist. So what I do is I talk to people, patients, family members, healthcare providers, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a chemical that you work with, a vaccine that you get, a condition that you have, or even a medication that you take. Today, we're going to be talking about the fourth trimester of pregnancy. Now, that may be a new phrase that you've never heard before or something that you're really familiar with. But basically what we're talking about is the first couple of weeks after the baby has been delivered, when people have a lot of questions about, is there changes in what I can take, especially if you're breastfeeding or have other concerns. Back again with us on the podcast today are Teratogen Information Specialists from MotherToBaby California. Welcome back, Kirstie Perrotta and Angela Messer.
Thank you. Good to be back. Thank you for having us. Always great to be on the podcast.
So very, very happy to have the two of you back. Can you remind the audience of your background and your role?
Sure. So I am a Teratogen Information Specialist with MotherToBaby California, and I am also a mom of two young boys.
And same, I'm Angela Messer, been here for 16 years with MotherToBaby, Teratogen Information Specialist with California as well, and I have a 6.5-year-old lovely daughter.
Okay, so let's jump right in. Those first couple of weeks postpartum, especially for new parents, but not necessarily, right? Because things change all the time. What are people calling and asking about in those first couple of weeks after delivery?
Gosh, lots of things. But mostly, I think we get, laxatives, stool softeners, very, very common after you deliver. Unfortunately, you deal with that. So many questions about that. A lot of people call about pain medication as well. It's a hard time. There's pain afterwards. So a lot of questions about over-the-counters, but also prescription, things like opioids. We get a lot of questions about these stronger pain medications after delivery. So going with that lowest effective dose, we can talk with people at MotherToBaby about that if they're concerned about, gosh, this is a prescription pain medication. I'm concerned about this getting into my milk, into the baby, and is this a concern? But we can talk through with that with you and make sure that you are using the appropriate dose.
Yeah, opioids, even the word, right?
Right.
Can sometimes feel scary because of things that we see. But with appropriate use, it is possible for many people to breastfeed while using opioids exactly as directed by their provider, as long as they, also keep a good eye on the baby.
Correct. We don't want people to be in pain. I mean, that's the bottom line.
Thank you. No, seriously,
yes,
thank you.
We don't want you to have to struggle. I mean, I think a lot of people call and think they have to just, here we go, fourth trimester, I just have to put up with a pain, pain afterwards, and this is what we do. And that's not necessarily true, and we want to make sure people know that.
Another common question we get is about cosmetics after delivery, right? So you've had the baby, everything that was previously off limits, they want to know, can they start using it again? So we'll get questions about hair dye, questions about Botox, different type of face products, right? So returning to your favorite lotion or acne product, things like that. And so that's a very common question. And a lot of the time we can be pretty reassuring based on the route of exposure. So if you're applying something topically to a small area of the body, we don't expect that it's going to enter into your blood and get into the milk in significant amounts. But it's always important to double check, right? We do have access to the latest research for lactation, and we're happy to go over individual cases with people.
Absolutely. One of the questions that I get commonly, and I know that we all do, is thinking about that postpartum and sort of the how you feel, how you look. It's, can I take this supplement for my hair and nails? I get that all the time. And I will tell you straight away that I was one of those people looking into that information. I had significant changes in my hair, and my nails are brittle as it is. And so that's one that we get a lot. Thinking, though, around things like that, supplements, any type of supplements, what does that look like in the breastfeeding space?
Right. So those hair and nail supplements typically contain very high amounts of vitamins, whether it's biotin or something else. You know, that's theoretically how they work to help with your hair and your nails. But in lactation, we want to be careful with those mega doses because typically we don't have studies looking at high amounts of biotin or other vitamins. So sticking with the recommended dietary allowance, or the RDA, is typically what's advised unless you're deficient or have some sort of other exception that you've talked to your doctor about. But typically you want to, stick with your typical prenatal or postnatal vitamin that has about 100% of the daily value for those vitamins. Nothing excessive is always a good thing to keep in mind.
And Angela, what about labels and herbal products and proprietary blends?
We have a favorite proprietary blend.
I know.
Very the same in pregnancy. I mean, we talked about that. We've talked about that before. Not well studied proprietary blends. These extracts and these, things that are coming up all the time. And we understand they can, for some people, be helpful. But again, just that lack of data in lactation and breastfeeding. And, we don't have any information to assess that, increased chance of things happening or things getting into the breast milk. We don't know how it might affect milk supply. And milk supply is a really big question we get. It's important for people who want to breastfeed.
Of course. So let's continue on the topic of beauty, because again, like on social media, you see a lot of things and you hear a lot of things, and it can be hard to know, what's okay and what's not okay necessarily. What about things like the salon, right? For nails and hairs. So never mind the supplements, but getting treatments, things like that. What's the skinny on that in breastfeeding?
That's a good question. So we get a lot of questions about that with, going to get nails done, gel nails, all these different kind of manicures that are out now.
Tips, fill.
Yes, all of it. Really, again, not specific studies in lactation, but again, route of exposure like Kirstie talked about, and going back to the smell, really, if it bothers you to, wear a mask or something, but really it's not likely to get into the milk, something like that. It has to get in your bloodstream to get to the milk. So again, as directed, we wouldn't suggest a concern with that.
Kirstie, can you tell us a little bit about route of exposure?
Right. So the idea is that in order for something to get into the breast milk, it first needs to be in your blood. So if you take a medication by mouth, if you swallow something, if you drink alcohol, that's a very direct route into the blood where it can then make its way into the milk. Topicals, though, like we're talking about, right? Getting a facial or having your nails done, things that are applied to the skin or even the nail, which is even more of a barrier. We really don't expect that much is getting absorbed through that and making its way into the milk. So like Angela said, we typically don't have great data and we can never be 100% without the studies. But when we think about how you are using the product, how you're applying it, we can usually offer a good amount of reassurance.
So what I took from that is please don't drink the nail polish.
Yes,
okay.
Exactly.
I was just going to say that. Also, we touch on, though, too, is that direct exposure to baby. So if you are using something, like a lotion or anything like that, or doing your nails, good hand washing after, make sure there's no direct contact with baby or the nipple area. And that's kind of what we end with as well.
Absolutely. Because that was something that I definitely thought about. So same thing with hair dye, right? So like if the nail is a great barrier, I know, scalp, skin, hair, still pretty good barrier.
Yeah, and some people even feel more comfortable with highlights as opposed to dyeing their entire hair, right? Because it's really kind of taking out that specific section, and so it's not getting on the scalp as much as like a full hair dye might be. So perhaps postpartum, you're more comfortable with that until you're done breastfeeding.
Right. That's awesome. Okay. I know you have one because we all do. What is one exposure-related myth in breastfeeding that you wish would go away forever?
Well, I think kind of a general one is just that many medications can't be taken in lactation, right? We hear that so often. My mom told me I can't take this, or my doctor wouldn't prescribe it for me because I'm breastfeeding. Absolutely. And typically that's not the case. A lot of medications are acceptable in lactation. It's of course important to check with the experts and, be aware of the available data. And especially for those younger babies or those preterm babies, know what side effects to look out for in case that were to happen. But usually most medications, are compatible with breastfeeding. And like we touched on earlier, we want mom to be feeling well, right? We don't want her in pain. We don't want her having uncontrolled asthma, uncontrolled depression, anxiety. These are all really important health conditions that need to be treated in that 4th trimester.
I'm really glad you brought up the mental health, especially with postpartum, because it's such an important topic to talk about. We get questions about that all the time. So that's something that we really will talk about with people when they call. What medications are they currently on? What were they on before? And the different data in lactation. But it's so rare that you really can't not take anything during lactation because I think there's only a really handful of exceptions. But in most cases, it's pretty reassuring.
And it's an interesting thing because there are some medications that, are not recommended for use in pregnancy that actually are okay to have in breastfeeding. So it's not always a one size fits all.
Correct.
Right. So a great example of that is the pain meds, right? So in pregnancy, we're pretty limited to acetaminophen or brand name Tylenol. That's kind of the first choice for fever, pain, everything under the sun. But in lactation, you have some more options. Ibuprofen is a great choice. Amounts in milk are typically pretty low. You just want to make sure to steer clear of aspirin. That's the one you need to avoid while breastfeeding.
I was just going to mention, we get a lot of questions about, things like GI related, like Pepto-Bismol. Speaking of aspirin related products, we get it. It happens. So, really important to know just the specific medications to kind of avoid, even though you can use more during breastfeeding, but always good to call Mother2Baby so we can, assess what you're planning to take for those things.
Absolutely. And I will be happy to share the one that I wish would go away is that, there is a wrong way to feed your baby. Mm-hmm. That's what I wish would go away. Mm-hmm. There is no one right way for everyone. It's not one size fits all.
Correct.
Many people are successful and happy with breastfeeding. And for other people, that's not an option. That's not a desire. Fed is best. So feed your baby. You're doing a good job.
Exactly.
Awesome. Angela and Kirstie, thank you so much for coming back. It is always a pleasure to have you. Lots of great information. Very good to see you both. Thanks for being on the show. And thanks for doing what you're doing.
Likewise.
Can you remind us about some of the great resources we have available at Mother2Baby?
Yeah, so MotherToBaby.org, that's kind of the one-stop shop to check out. We have so many great resources on there. Of course, you can find this podcast on there. You can find our baby blogs. You can find our fact sheets. We have more than 300 at this point in English and Spanish, designed to be written in a way that's easy to understand, right? So if you're a patient that doesn't really have that medical background and you want to understand how this exposure impacts a pregnancy or breastfeeding, then you can find that data right there. And then, of course, if you want to speak with someone, we are available. So you can call, chat, text, or email to get connected with a live person. You might speak with me, you might speak with Angela, but we are always happy to take your questions. No question is off limits. We have gotten, everything under the sun, and I think, it's better to ask than to wonder and, think you're making a bad decision or have uncertainty still. So we're happy to take any question.
I'm so glad that we have so many channels. We have chat, phone, email, and text. You can reach us so many ways, and we're available anytime to speak with anyone.
Absolutely. And must plug our incredible pregnancy studies. Of course, information is limited in pregnancy on a lot of medications, exposures, and conditions, right? Let's not forget conditions, things like, lupus, for example. And, we're out there, we're trying to collect that data. So if you're interested in pregnancy studies, if you want to contribute, if you want more information, if you're a healthcare provider and want to refer your patients, as Kirstie said, MotherToBaby.org is your one-stop shop.
Yes.
Well, thank you both for being here and can't wait to see you back in the future.
Thank you so much.
And that's going to do it for this episode of the Mother2Baby Podcast. Be sure to hit that subscribe button so that way you never miss a new episode. And you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. If you want to be on the podcast or if you have an idea for the show, we would love to hear from you.
please feel free to email us at contact@mothertobaby.org. And MotherToBaby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the MotherToBaby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website.
MotherToBaby would like to take a moment to thank our very generous donors who help support the important work that MotherToBaby does. Jason Alexander, Emily Gravelet, Chad Haldeman Englert, Lori Harris-Sagadabai, Jamie Hung, Beth Kiernan, Kendra Kramer, Nevina Christic, Ruth Moss Katznelson, Sarah Obachan, Kirstie Perrotta, Alfred N. Romeo, Anna L. Taylor, and Elizabeth Wasternack. Thank you all for your generous support. And if you're interested in becoming a donor, be sure to visit our website at MotherToBaby.org. Until next time, remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratogen Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.